seems like sports are on almost everybody's minds.
And once again, we're talking to doctors this morning about sports injuries. This time, Dr. Irwin Goldstein is joining us about some of the common injuries that people sustain when they're working out. So are you finding that more people are overdoing it because of the Olympics? They're inspired?
Well, you know, first of all, thank you for having us on.
You're welcome.
It's Anatomy 101 when we're talking about bicycle riding. People sit on their penises and clitorises and they injure their sexual lives, and we have to bring this up to attention.
Wait, back up. They're sitting on their what's and injuring their whats?
They're sitting on their clitorises and penises, so they're injuring their sex lives, and we have to bring this up to attention.
So you're talking about
That's what I thought you said.
Cycling. So tell us about, you know, why that's happening and that kind of injury is being sustained by people.
So before I do that, I just want to say the cyclists in the Olympics are awesome, and they're amazing. But we're talking about you and I, people who aren't these full-time athletes who, you know, take out the families and just go on rides.
Right.
The thing is, I'm going to show you a classic tricycle sort of seat. When you sit on this saddle, you don't sit on your crotch area. When you sit on this thing over here with a cutout down the middle, you're basically putting your entire weight on the clitoris or penis as you sit in your crotch area.
Right.
That can't be good because that stops the blood flow and that stops the nerve supply to those areas.
Well, I got to ask you, how do the athletes handle that?
Well, that's a different conversation. They have different motivations.
Right.
We're talking about you and I and sex life.
Right. Well, you and I, we don't spend quite as much time on those bicycles as the athletes do, but do people actually come into the doctor to complain about those problems from
Well, not
cycling?
only do they do that, I just operated on 2 young kids in their 20s, and one was 18 who developed sexual problems because of bicycling. So it's actually a big problem.
Wow, like what kind of problems do they develop?
They lose performance because they block the arteries, and they also can hurt the nerves, so they lose feeling and lose orgasmic function.
So how do you get around that? How do you protect your privates while you're enjoying your bicycle?
Well, you purchase one of these babies. These are the wide things that you don't sit on your crotch.
So you're looking for a wide seat then?
Well, you know, we just had an article published in this journal, called the Journal of Sexual Medicine, and it's called, if we can focus in on it, Cutting Off the Nose to Save the Penis. It's actually an interesting,
They actually say to
title.
cut it off?
And what it shows is that we took bicycle riders who were actually policemen, and we had them convert from the sort of traditional Lance Armstrong version to the wide saddle that I just showed you.
Right.
And the point is that they actually improved erectile function changing their seats, and they actually improved their sensation to their genitals.
You know what's interesting? You said these were young people that came in. So when do we start having to be concerned about what type of seat or even our kids are riding on?
Well, throughout all the ages. The thing is, these kids were BMX riders when they were young, and they do the flips and twists and jumps, and they land on their crotch when they ride these.
Ouch!
Yes, it is something, and we have to make attention to it. So I think the Olympics are great. You know, the athletes are amazing human beings, but when it comes down to us, we should be a little more cognizant of anatomy, that's all.
All right, to be fair for both sexes, Doctor, now, and Bridget and I are not cyclists, so we would not know the answer to this, but what does too much pressure on the seat do to the woman?
No, same thing. It causes numbness, and they lose orgasmic function. We see that a lot. I just had a woman in a few days ago with the exact same situation. So a spinner or a bicyclist who does a lot of this, they get numbness. And when you get numbness, you've got to be careful. The nerve is right next to the artery.
Okay, well, something that we didn't know this morning. Thank you very much.
All the people at the gym working out are going to be jumping off the cycles right about now. You know, they're going to the what are those things called? The ellipticals. All right, thank you, Doctor.
Thank you so much for your advice. Appreciate it. All right, you too.
Dr. Irwin Goldstein.
From Alvarado Hospital this morning.
Who knew?
Who knew?